there, my name's Melanie. I'm your student nurse and I'll be taking care of you today. What's your name?
Sam.
And what are you in for today?
A routine checkup.
Perfect. So today I'll be performing a full assessment on your head, which includes your ears, eyes, nose, and mouth, your neck, and then your chest, which would be your heart and your lungs. Alright, Sam, first I'm going to start with an assessment of your skin. I'm going to check the color, and the color is normal, and your skin is pink like it should be. I'm going to check the temperature of your skin.
That's all. That's all.
And the temperature is warm. And now I'm going to check the moisture and the mobility and turgor of your arm, and what I'm going to do is I'm going to pinch the skin up. And your skin went down really quickly, so that means you're hydrated and the turgor of your skin is good. And now I'm going to check and see if you have any lesions, which you don't, which is perfect. But if you did have any, I would use the ABCDE test to inspect them. So now I'm going to inspect your nails. Okay. So they are good. They're at about a 160-degree angle, which is perfect. And now I'm going to blanch them. Perfect. And the capillary refill is less than 2 seconds. And now I'm going to inspect your head, and I'm going to check the shape. The shape of your head is good. And I'm going to palpate your scalp, and then check the superficial temporal artery. Okay. Okay, and the temporal artery is right here. Perfect. And now I'm going to inspect your face, and the symmetry of your face is even. And I'm going to check and see if you have any edema around your nose or your eyes. Okay, good. There's no edema. And now I'm going to inspect your nose. So what I'm going to do is I'm going to palpate it, and then I'm going to occlude one nostril, and you're going to have to sniff for each nostril that I occlude. Okay? Okay. Perfect. So your nose isn't stuffy. And now I'm going to palpate your sinuses. So I'm going to do your frontal sinus first, which is on your forehead. And then I'm going to palpate the maxillary sinus, which is under your eyes. And let me know if there's any tenderness. Okay. Okay, perfect. Okay, Sam, now I'm going to inspect the range of motion of your neck. So can you first touch your chin to your chest? Okay, and now can you move your neck side to side? No, like this. Yeah. And then can you touch each ear to your shoulders? Okay, and can you extend your neck backwards? Okay, good. And now I'm gonna locate the temporomandibular, which is on the sides of your jaws, and when I touch them, just open and close your mouth. All right, perfect. Okay, so now I'm going to palpate the sternocleidomastoid, which is the muscle on the side of your neck, and also the trapezius muscle. So here, and then back here. Okay. Okay, so now I'm going to palpate your trachea. And I'm going to palpate the thyroid gland, which is in the middle of your neck. Perfect. And can you please take a sip of your drink and swallow? Perfect. Okay, so can you turn to the side? All right, so I'm going to palpate your trachea, and can you put your head down and to the right and swallow? Okay, and can you put your head down to the left and swallow? Perfect, thank you. Okay, and now I'm going to also take your thyroid gland on the right and left side. And you just have to swallow. Perfect. Okay, Sam, now I'm going to palpate your lymph nodes. So we have the pre-auricular, the post-auricular, the occipital, the submandibular, the submental, the tonsillar, the anterior cervical chain, and the posterior cervical chain, and the supraclavicular. Okay, and now I'm going to inspect your mouth. So the lips and the shape of your mouth are good. You can close your mouth. Okay, and can you open your mouth and put your tongue to the roof of your mouth? Okay, perfect. You did that with no problem. I don't have a tongue depressor, but if I did, I would use it to look in the back of your throat and assess your tonsils. Now I'm going to palpate your ears and let me know if there's any tenderness. And now I'm going to do the whisper test. 3T7.
3T7.
9NZ.
9NZ.
Perfect. And now I'm going to inspect your eyes. There's no drooping, no infections, or no tumors. Your eyebrows and eyelashes are evenly distributed. Can you blink for me? Perfect. You blink with ease. And I'm going to palpate under your eyes and see if there's any tenderness. No? Okay. And now I'm going to separate your eyelids and I'm going to have you look up, down, left, and right. Perfect. So your sclera is white. And now I'm going to pull down your lower lid and check your conjunctiva. Okay, Sam, now I'm going to check your eyes. I'm going to use my pen light. Perfect. Pupils are well. And now I'm going to check for the concentric light reflex. So I'm going to shine my light in your one eye and see if your pupil responds to that. Perfect. Excellent. And now I'm going to check for accommodation. So this means I'm going to hold my finger 10 centimeters from your eyes and your pupils will accommodate to looking at my finger. Okay, good. So they do change shape. Okay, Sam, now I'm going to do a visual fields test. So if you could please stare at my nose and I'm going to put up different numbers and different quadrants and let me know what they are without looking at them, okay?
2, 3, 4, 5.
Okay, perfect. And now I'm going to check your extraocular movements. So I'm going to move my pen light around and you have to follow it with your eyes, okay?
Yes.
Okay, Sam, now I'm going to inspect your thorax, which is your chest area. So just from looking at you, you are breathing normally. Your facial and lip color is pink and normal. Your nails. Your nail color is pink. You have a normal chest shape, no deformities. Your trachea is at midline like we checked earlier. Your respirations are normal and even. And can you take a deep breath? Okay, Sam, now I'm going to palpate your posterior thorax. Okay, now I'm going to assess for fremitus. So every time I put my hands on your back and move them down, I need you to say 99, okay?
Yes.
Okay.
99. 99. 99. 99. 99. 99.
Okay, perfect. So now I'm going to palpate for respiratory expansion. So what I'm going to do is I'm going to put my hands at T9 and T10 on the middle of your back. And then I need you to just breathe in and out. Okay? One more time. Perfect. Okay, Sam, now I'm going to percuss your posterior thorax, and I'm listening for resonance over your lungs. Okay. I'm going to test you for a diaphragmatic excursion. So what I'm going to have you do is I'm going to have you exhale forcefully. Then I'm going to percuss from the T7 midscapular line and mark when the tone goes from resonance to dullness. So can you please exhale forcefully and then hold your breath? Okay, and you can breathe normally. Okay, and now I'm going to have you take a deep breath and then hold your breath. Okay, all right, you can breathe normally now. Okay. All right, so it's about 7 centimeters. All right, Sam, now I'm gonna listen to your posterior thorax. So everywhere I put the bell of my stethoscope, I need you to take a deep, complete breath. All right, perfect. Okay, Sam, now I'm gonna observe your chest area and I'm gonna use my ball of hand to palpate and detect thrills and pulsations in your aortic area, pulmonary area, right ventricle area, apical area, or an epigastric area, and also the point of maximal intensity. So right here is your aortic area, and here is your pulmonary area. Here is the right ventricle area. And right here is the apical area and left ventricle. And here's the epigastric area. And also the point of maximal intensity is right here. And now I'm gonna listen for S1 and S2, so you can just breathe normally. All right. So this is your aortic area. And here's your pulmonic area. And right here is Erb's point. And here's the mitral area. And the tricuspid area. Okay, Sam, now I'm going to locate all your pulses. The only one that I have to listen to is your carotid artery, and I'm going to apply the bell of my stethoscope to it, and I'm going to have you take a deep breath, exhale, and hold it briefly. All right, can you take a deep breath and exhale? And hold it? Okay, thank you. Okay, now I need your arm. So your brachial is right here. So I would rate that as a 3+. And then your radial is right here. I would also rate that as a 3+, and 3+ means it's normal. And now you have your ulnar artery. Okay, and 3+, and then the popliteal artery, which is behind your knee. Okay, a 3+, and the posterior tibial, which is right here. Okay, and the dorsalis pedis, which is right here on top of your foot. Okay, and your femoral is like in your thigh area, like right here. All right, perfect. Okay, Sam, now I'm gonna perform the Allen's test on you, so if you can make a fist, and I'm gonna time it for 30 seconds and occlude both arteries. And I have it timed. Okay, you can unclench your hand. And your hand did turn pink right away after I did the ulnar artery. Okay, so now I'm gonna do it again, but with doing the radial artery. So let me reset this. Okay, can you clench your fist? Okay, you can unclench your fist. And your color returned right away. All right.